Welcome, and thank you for taking the time to watch this video on skilled nursing facility 3-day qualifying stays. I'm Tom Ryan with WPS Government Health Administrators, Provider Outreach and Education. Recently, we've received a lot of questions on what a 3-day qualifying stay is for a skilled nursing facility. I'll answer that question in just a moment, but before I do, I want you to understand why it's important. Without a 3-day qualifying stay, a skilled nursing facility cannot bill Medicare. This means that other providers will not be subject to skilled nursing facility consolidated billing. If you're not subject to skilled nursing facility consolidated billing, then you will bill Medicare directly for the services. Let's start by defining what a 3-day qualifying stay means for a skilled nursing facility. A 3-day qualifying stay is met when the patient is inpatient in a hospital medically necessary stay of at least 3 consecutive calendar days. After discharging from the hospital, the patient must transfer to a Medicare certified skilled nursing facility within 30 days. Medicare does have an exception to the 30-day rule, but both of these two components must be met. The patient's condition makes it medically inappropriate to start skilled nursing facility active treatment immediately after discharge. And at the patient's hospital discharge, it's medically predictable they'll need covered SNF care when a set period of time has passed and they meet that prediction. Keep in mind, this is generally not more than 30 days. Medicare does not offer an exception to the 3 consecutive calendar day rule. So let's define what is considered a calendar day. The first common question we receive is, does the day of admission count towards the 3 days? Yes, the day of admission counts towards the 3 days. The other common question we receive is, does the day of discharge count towards the 3 days? No, the day of discharge does not count towards the 3 days. Let's illustrate this principle with an example. The patient's admission occurs on February 1st. This counts as day 1. The patient remains in a medically necessary hospital stay at midnight starting February 2nd. This counts as day 2. The stay continues at midnight on February 3rd. This counts as day 3. The patient is discharged to the skilled nursing facility on February 4th. This day does not count, but the patient does have a 3-day qualifying stay. Next, we'll move on to what counts as inpatient in a hospital. The easiest definition for inpatient care is when a doctor orders a patient to a medically necessary inpatient stay. Medicare will consider this an inpatient stay as long as it's medically necessary and for medical treatment, as well as food and lodging. A common question we receive is, does a day in the emergency room count towards the 3-day qualifying stay? No, when a patient remains in the emergency room at midnight, this does not count towards the 3-day qualifying stay. Another common question is, does a day under observation care count towards the 3 days? No, observation care does not count towards the 3-day qualifying stay. Let's summarize all the information given with an example. The patient arrives at the emergency room on January 30th at 11:30 p.m. This day does not count as part of the 3-day qualifying stay. The emergency room doctor decides that observation care is best for this patient. The observation admission occurs on January 31st at 2:15 a.m. As the admission is to observation, this day will not count towards the 3-day qualifying stay. The patient's condition continues to decline during the observation care. The decision is made to get the patient to an inpatient facility stay. The inpatient admission occurs on February 1st at 10:30 a.m. The admission day counts as day 1 of the 3-day qualifying stay. The patient remains in a medically necessary hospital inpatient stay all day on February 2nd. This counts as day 2 towards the 3-day qualifying stay. On February 3rd, the patient's condition is better. The hospitalist determines the patient can be discharged. The inpatient hospital discharge occurs at 3:45 p.m. This is the day of discharge, therefore it does not count towards the 3-day qualifying stay. In this case, there is no 3-day qualifying stay. That means Medicare will not consider the skilled nursing facility stay for payment. As Medicare does not consider the skilled nursing facility stay for payment, consolidated billing does not apply. For more information on skilled nursing facility billing, review the Medicare Learning Network Matters tool, Skilled Nursing Facility Billing Reference. To open this reference, select the info button in the upper right corner. That's it for this video on the Skilled Nursing Facility 3-day qualifying stay. We'd love to hear your thoughts on this video. Take our online survey to provide the feedback. If you found this video helpful, like and share it. Consider subscribing to our YouTube channel so that you know when we post new content. Thanks for taking the time to watch this video, and everyone have a great day.